I hope all of us take inspiration in facing our mountains, or the mountains in our lives, with the courage and the dedication that Chariot showed. In other news, the Ministry of Health now says that there are stockouts of key vaccines with less than 2 months of stock available nationally for traditional vaccines, such as the BCG vaccine, the oral polio vaccine, and the measles-rubella vaccines. Additionally, stock levels for most other routine childhood vaccines, including those supported by Gavi, are low, with only 3 to 6 months of stock available. And as Elizabeth Atieno now reports, AMREF, Africa CDC and the WHO have called for enhanced local production for vaccines, further urging the Kenyan government to set aside funds to tackle the vaccine crisis. Take a look.
Kenya is still grappling with an acute shortage of childhood vaccines, with 10 counties bearing the greatest brunt. And now, AMREF Health Africa CEO Dr. Githinji Gitahi has urged the government to ring-fence funding for vaccine procurement and distribution and incorporate a sustainable budget for vaccine procurement in the country.
And what that means is that the vaccines that are supposed to be bought from the country's own contribution or fiscal space will then end up with a shortage, because this whole entire plan of volumes is based on the cohort of births in a country.
The shortage of life-saving childhood vaccines in Kenya has been attributed to the 3.6 billion Kenya shillings debt owed to suppliers including Gavi and UNICEF. In its recent statement, the Ministry of Health says 1.25 billion Kenya shillings has been set aside to urgently procure routine antigens and replenish the life-saving vaccines in health facilities.
Without vaccination, that is going to be a nightmare. It's going to be a catastrophe for our young children, newborns, and even under 5s.
Kwa sasa, dawa zile ambazo ziko na upungufu ni zile za measles na zile za polio.
Stakeholders in the health sector say the local manufacture for vaccines is the only solution to the ongoing crisis. For instance, currently there are about 30 vaccine manufacturing plants in Africa. 9 do have adequate capacity for production. However, only 3 have the capacity to produce vaccines in the short term, that is 3 to 5 years.
And the vaccine they can produce are the 8 vaccines that are the most used for routine vaccination.
Africa CDC says the main challenge in local vaccine manufacturing is on financing and lack of adequate market.
Even if you produce the vaccines, if there is no market for the Africans to buy African products, all those efforts will be just nullified.
The investment in harmonization needs to be recognized from the very beginning. And if we're going to do pool procurement on a continental level, it's very, very important.
But we are also aware that the president is pushing for us to have a vaccine center in Kenya. So that one will actually sort out all our problems.
The ongoing shortage of life-saving vaccines poses a serious health risk to 1.6 million infants who might be susceptible to diseases like polio, tetanus, diphtheria, whooping cough, diarrhea, pneumonia, and measles. Elizabeth Atieno, TV47, Nairobi.